everyone. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board certified plastic surgeons. My name is Dr. Ashley Amalfi, and I am a board certified plastic surgeon in Rochester, New York. And I am here with
Dr. Smita Ramanathan, and I am a board certified plastic surgeon in New Jersey. And we are so excited today to talk to you about the uses of Botox that you might not know about. So, what are sort of these off label uses of Botox or Dysport or some of these other neuromodulators that people don't often talk about? So, we're going to lay it all on the line today. And you'll be surprised about what you'll learn about in the next 10 or 15 minutes.
Yeah, there are some really kind of crazy cool new things that we're doing with Botox. And I think this list is just going to keep growing. But, we're going to talk to you guys about everything kind of beyond this forehead area today, because that's usually what you think about for wrinkles and little smile lines at your eyes. But we're going to talk about the less commonly talked about uses for Botox, and we'll just kind of start at the top and work our way down. So gummy smile, you guys. So that's when you smile and you see a lot of your gums above your upper teeth because that lip is pulling up. That is such a cool and easy fix with Botox. Do you see a lot of people with this, Smita?
I do actually, and it's so funny because I think it really became more popular over the past year or so, maybe year and a half, where I've had patient after patient come in and they're like, "Oh, I've always been so self-conscious about my smile, and I never knew that there was anything I could do about it." And then they saw it somewhere, or they saw it on social media, or they read about it, and they're like, so they come in just wanting more information. And it's such a great thing because it doesn't take a lot of Botox. It just needs to be very strategically placed in the right muscle, and that's really determined by your examination. But in 2 weeks, once everything starts working, people are like, they're just so happy and they're showing off their smile, and they've never been able to do that before. So I think it makes such a huge difference, and it's one of the things that I love doing the most because, everyone's smile is beautiful and they should feel beautiful
Yeah.
smiling.
Yeah, it's one of those ones that they don't even know about. So once I've had a patient for a while, then, and they have a gummy smile, it's just something I let them know. And it might feel a little weird at first because you're so used to having that big upper teeth show when you smile. And so I just tell them that I'm like, what, let's try the tiniest little dose and see what you think. If you hate it, we never have to do it again and it'll go away in a couple of months. But if you love it, then you just found this fix for something that's kind of been bugging you your whole life that you didn't even know. So, sometimes people are in tears because that's something that really bothers them and they didn't know that there was something so simple. I mean, this is the tiniest little muscle, guys. It's just a little injection under the nose where that muscle wraps around, and just weakening it a little bit gives you this perfectly straight across smile that you didn't even know was so possible.
And I think and the thing also is that we don't want to change the shape of your smile, right?
No.
I mean, I think oftentimes people go to someone who may not be familiar with the anatomy or really understand where these muscles are. We're talking about two muscles. So the one that you described is sort of at the side of our nose, and that pulls our lip up. And gives us the gummy smile. But also if we have an overactive orbicularis oris, which goes around our lips, it can sort of really curl our lip in, right, when we're smiling. And so based on your anatomy in your exam, we can sort of determine if it's both muscles, one muscle or the other, and then a little bit of Botox or Dysport or whatever that neuromodulator is in that muscle can really sort of relax everything. And preserve how you look when you're smiling, right? Nobody ever really wants that like heavy upper lip, which some people, even with the slightest bit of Botox, I don't know if you notice, they do feel that initially just because it's something new. It feels a little weird, like when you try to take a sip or something, it feels a little weird. But after a couple of weeks, you sort of get used to it, and you're happy. But it does feel weird initially.
Yep, exactly. Just because it's different and you're used to certain movement and the movement is just a little bit different. But ultimately, then they start seeing pictures and they're like, oh, yeah, this is great. We're going to keep this up because I really like the way my smile looks so much better. So that's easy. Yeah.
That's really easy. And I think the added benefit to that also is you get a little bit of that lip flip
It looks
portion of
bigger.
it,
Yeah.
So
Your
your
lip
upper
looks a
lip
little
does look a
bigger.
little bit bigger. Yeah. So you
And
don't have that
no one
upper lip
hates
that
that.
disappears. Everybody loves that.
Yeah,
Yes.
it's always nice to have a
So
little bit of lip when you smile. So yeah, there's added benefits overall. So that's such an easy one. What's
yeah.
another common kind of strange or like less common place that you use Botox?
Yeah, so I think the next area is really sort of the jaw. We have these two big muscles, the masseter muscles, which can give us a very kind of square, wide jaw, but also can be hyperactive. And so people can grind their teeth at night, and it can cause a lot of pain in the jaw area. So putting Botox within the actual muscle can weaken it over time, and it can slim your face too, which is really nice, the ability that we're able to do that. So
It
how
can
about you? Do
be.
you see a lot
Yeah.
of those patients? Yeah.
I actually see a ton of them. I mean,
Mm-hmm.
I see all those complaints. I see people who are kind of clenching their jaw, which my dentist told me today I'm doing. So
Oh,
maybe we'll try it.
maybe.
There's definitely teeth grinders who feel a lot better when they do that as well. And then I
Mm-hmm.
also have patients who just don't like how it looks because their muscle is really bulky. And so it gives them a very square look to their face, which sometimes a chiseled face is nice, but it's just too much. And that slimming
Mm-hmm.
is amazing. Like I have some patients who we've been treating for years and they look like a different person because their shape
Right.
of their face was kind of like this upside down triangle because the jaw got so wide. And then we give them
Mm-hmm.
back that nice egg shaped face when we slim the lower face. So it's amazing
Right.
how useful this is. And for a lot of people, it's a super functional thing to do too if you have jaw pain from some of those motions. So another
Yeah.
really easy injection, I usually will inject 3 to 5 points on the muscle, and everyone's muscle is a little
Mm-hmm.
different. So I really feel that anatomy and feel where that muscle is a little bit bulky just to weaken it just enough. You talk to them about overdoing it. Like you never want to overdo master Botox because we want to still be able to eat.
Mm-hmm. Right, exactly. You still want to have your steak or your chicken or whatever it is. Yeah, right. You want to be able to choose. So it's one of those things again, you do need more Botox or Dysport or whatever in that muscle because it is a very strong muscle. So, if you, for instance, get 10 units in your forehead or 12 units, I mean, you're going to need a lot more. I would say a minimum of, I mean, I usually start with 16 and then I usually go up from there
I
because you don't
I
want to
start
overdo
yeah.
it.
I start at like 12 and a half and then I go up from there. So
And you
similar.
go
And
up.
sometimes you need double that or even more, but less is
Right.
more.
Less is more. So you do need more of it, and that's per side. And oftentimes it does take more than one treatment to get that slimming effect. I think with all of these things, it's so interesting because, we do these treatments to sort of treat something, right? So, Botox we started injecting here to treat the clenching or the grinding. And then we started noticing, oh, well, it's actually slimming people's faces. And now, it looks great, right? And so now we're starting to use it just for the slimming effect. But it does take more than one treatment because you really have to sort of weaken that muscle. And that doesn't happen, after one treatment. So just something to keep in mind. But it's a great little procedure for Botox.
Yeah,
Yeah.
and if it doesn't treat your grinding and your clenching, then we don't have to do it again. But it's always worth giving it a shot. If that's something that bothers you, give it a shot, and then we'll try a bigger
Right.
dose. And for most people, it really does make a difference. And so
Yeah.
yeah, totally
Absolutely.
worth a shot.
All right, yeah. So, what other areas are you seeing or treating with Botox or Dysport that
I
people
think
might
this
not know about?
Yeah, I think this lower face is interesting because we can
Hmm.
treat, as we age, our smile turns from like that resting face where we have like a little smile to it to that kind of down turning face with the corners of our
Hmm.
mouth going down and putting Botox in some of those depressor muscles is really helpful to help turn up the corners of the mouth. Um, Same in the chin. So similar area,
Yeah.
but the muscle in the chin can kind of grimace when we make a frowny face, and weakening all of those muscles just helps the harshness of the lower face that can create like those dimples or those kind of concavities in the corners of the mouth. It just softens things up and gives you kind of like that permanent smile, happy face.
Yeah,
Are you
exactly.
doing
I
a
think
lot
the
of?
dimpling. I do a little bit in the depressor. I've done, I do a good amount with the dimpling in the chin. I think it does weaken that muscle. I tend to combine this with fillers sometimes because I think a little bit of filler, like right in this corner, can sort of
Plump
upturn
it
that.
up? Yeah. Yeah, that's a
But
great combination.
yeah, but I think same thing here, less is more. You want to be able to close your mouth and, sip a straw and all of that stuff. So it's really important, again, to go to someone who understands the anatomy, because there are many muscles in that area. You don't want to weaken the wrong muscle, which can happen, unfortunately.
Yeah, the theme here is just start small, especially when we're doing all
Yeah.
these kind of very like unique little off-label things. We're just kind of
Hmm.
playing with your muscles and your anatomy to get you whatever your desired effect is. So small goes a really long way, but what we can't emphasize enough here is that we're talking about really intricate facial anatomy here, and
Yeah.
this you need to know what it looks like on the inside and the outside to get this right. And so
Right.
that's why these nuances are so important to get you a really great result versus having some very unwanted outcome. So anything else? Do
Right.
you do a lot of neck injections with
I
neuromodulator?
do. I do. I think again, like you said, less is more, right? But I see two types of patients for neck. One is if when you start developing those platysmal bands or those two long vertical bands, usually two, sometimes people have, four or five, but putting a little bit of Botox right along that edge of that muscle just weakens it enough that it's just softer. So every time you're talking or turning or doing whatever, you don't see those like bands stick out as much. So I do it for that, and then I also do it for the horizontal lines that people get, the tech neck or whatever they call it these days, where you get these deep lines. And I find that doing a little bit of dilute fillers in the lines themselves with a little bit of Botox in the muscle just really sort of makes those lines a little less harsh.
Yeah, just a little bit softer. So besides all of those neck injections, there's one other kind of atypical thing that we do with Botox that people don't know about, or you might have heard about and you thought was totally bogus and not true.
Right.
Do you see people for this? You know what I'm talking about?
I know exactly what you're talking about. Do you want
Yeah.
to reveal
Yeah.
it?
Yeah, sure. Botox or neuromodulators are a great treatment for sweating. So for patients who have what we call hyperhidrosis, means you just sweat too much and it's armpit sweat where, in a very non-exertional way, you're just sweating all day long, almost like an embarrassing way. We can treat that by treating the apical glands around the hair follicles and treating them with a little bit of Botox, which reduces that sweat production in the area in a very safe and super effective way.
Yeah. I mean, it works great. I see a lot of people that come in sort of right before a big event, if they are in a wedding or they're getting married or whatever it is, and they don't want like the sweat stains on their dress because a lot of the dress, like the material just is not forgiving as far as getting wet and showing up in pictures. So yeah, I mean, I think it's very common for like brides to get their armpits injected with Botox. But I also see it in the hand too. If you have hands that like are just excessively clammy and or like soaking wet just from sweating, you can inject Botox in that to just minimize the sweating. And it's great because it lasts 3 months again, and you just go back to normal. So you can try it. If you love it, you can continue, and if you don't, you don't need to. Well, this is great. This is
Yeah.
great. So all the atypical ways we use neuromodulators. I mean, we could talk about Botox and Dysport, and there's just so much to talk about. So we'll cover these topics eventually on Lipstick and Lipo. So
Yeah.
if you love what you hear, subscribe, follow along with
More.
us, and we'll teach you all about plastic surgery.
More in depth coming your way. Take care, guys. Thank you. Subscribe.
Bye.